This video examines the pharmacological and forensic profile of Risperidone, also known by its brand name, Risperdal. We will explore its clinical use, adverse effects, interactions, and potential for misuse. Risperidone is an atypical antipsychotic used to treat conditions like schizophrenia and bipolar mania. Dosing must be carefully managed, especially for special populations or pediatric patients, where age and body weight guide the protocol. Understanding the adverse effect profile is critical for safety. These effects range from manageable symptoms to severe, life-threatening conditions that require immediate medical intervention. Common side effects include fatigue, blurred vision, and dry mouth. More serious metabolic concerns, such as weight gain and hormonal imbalances, require ongoing monitoring through blood panels and dietary oversight. Neurological risks include tremors and potentially irreversible movement disorders. In emergency situations, such as neuroleptic malignant syndrome, immediate medical attention is required, as these events can be fatal. Risperidone interacts with many substances. Its profile is particularly volatile when combined with drugs that affect liver metabolism or central nervous system activity, potentially leading to severe health complications. Mixing risperidone with illicit substances is dangerous. Stimulants can cause severe blood pressure spikes and muscle spasms, while opioids drastically increase the risk of respiratory failure. Cannabis can further intensify cognitive impairment and sedation. Interactions with prescription drugs are also significant. Combining risperidone with certain heart medications increases the risk of fatal arrhythmias. Furthermore, antidepressants can interfere with the drug's metabolism, causing toxic levels to accumulate in the body. Other interactions include dopamine agonists, which can counteract the medication's intended effects, and anticholinergic agents, which may lead to severe delirium or physical obstruction. Monitoring is essential when balancing multiple prescriptions. Patients often describe feeling dumbed down or zombie-like on risperidone. While this state resembles the effect of some stimulants, the underlying mechanisms are completely different, as risperidone acts to block receptors rather than stimulate them. This zombie effect is caused by dopamine depletion, which reduces motivation, as well as the drug's antihistamine properties and the suppression of metabolic activity in the frontal lobe, which impairs complex thought. In contrast, stimulants like Ritalin create a state of hyperfixation. Where a Ritalin user may appear robotic due to overstimulation, a risperidone user typically appears sedated and mentally slowed down. Regarding forensic toxicology, risperidone is not classified as a narcotic. However, it is sometimes diverted in controlled settings, like prison systems, by individuals seeking to manage the effects of stimulant come-downs. Because the liquid form of risperidone is colorless and odorless, it has been associated with cases of surreptitious administration. Combined with alcohol, its sedative effects are amplified, increasing vulnerability in dangerous situations. Finally, we must emphasize the FDA black box warning for elderly patients with dementia, as the risk of stroke and death is significantly elevated. Cardiovascular complications remain a primary concern for any patient taking this medication. Moving on to diagnostic testing, standard workplace drug screens, including typical 5 or 10 panel tests, do not detect risperidone. Investigators must specifically request advanced forensic panels using liquid or gas chromatography mass spectrometry to confirm exposure. Toxicology windows vary based on the sample type. Following a single oral dose, the drug typically causes sedation for up to 24 hours. Blood tests can detect the substance for 1 to 3 days, while urine assays extend this detection window to 4 to 6 days. For longer-term detection, hair follicle testing can identify ingestion events within a window of up to 90 days. However, it is important to note that hair testing will not catch an acute poisoning that occurred within the last 5 days, as the hair has not yet emerged from the scalp. Age significantly impacts how the body processes risperidone. Younger adults generally process the drug predictably due to efficient organ function. In contrast, aging organs and physiological changes in the elderly can lead to erratic and potentially toxic outcomes. Key differences include liver and kidney function, which decline with age, and the integrity of the blood-brain barrier. Furthermore, baseline dopamine levels are higher in younger individuals, whereas older adults may already face dopamine deficits, increasing the risk of adverse reactions. Pharmacokinetically, liver clearance of risperidone slows significantly in older populations. If an older individual also takes certain enzyme-inhibiting medications, the drug can pool in the bloodstream, transforming a standard dose into a dangerous overdose. Renal function also declines with age, causing metabolites to build up and extending the drug's presence in the system. Additionally, because risperidone is fat-soluble, it can become trapped in the increased body fat of elderly patients, acting as a slow-release reservoir. Toxicodynamically, the aging blood-brain barrier becomes more permeable. When combined with other central nervous system depressants, this can lead to immediate confusion, loss of physical coordination, and respiratory risks. Dopamine receptors also diminish with age. Consequently, risperidone may trigger severe movement disorders, known as extrapyramidal symptoms, and can render Parkinson's treatments ineffective. Cardiovascular vulnerability is another major concern. Risperidone can block alpha-1 receptors, causing orthostatic hypotension. In the elderly, whose blood vessels are less resilient, this often leads to fainting and high-risk fall injuries. For elderly patients with dementia, risperidone carries a significant risk of stroke. This is serious enough that it warrants an FDA black box warning, highlighting an elevated risk of sudden death in this specific population. If covert exposure is suspected, immediate emergency medical evaluation is necessary. Monitoring cardiac rhythms and blood pressure is critical. Always ensure medical staff are aware of the potential for atypical antipsychotic exposure to facilitate proper testing. Additionally, preserving physical evidence, such as beverage containers or clothing, is vital for law enforcement. If the drug was administered, gathering these samples promptly can assist in investigations. Regarding safe discontinuation, risperidone must never be stopped abruptly. Doing so can trigger withdrawal symptoms, rebound psychosis, or insomnia. Tapering must always be overseen by a healthcare professional. In summary, understanding the complex interactions and physiological impacts of risperidone is essential for safety. Prioritizing proper medical oversight and accurate diagnostic testing is the most effective way to manage the risks associated with this medication. When considering interactions with illicit substances like dissociative anesthetics, such as ketamine or PCP, the risks are severe. These substances disrupt glutamate pathways and alter dopamine levels, which, when mixed with risperidone, can trigger unpredictable neurological reactions, including profound sedation or an inability to communicate. Certain prescription medications also pose significant risks when combined with risperidone. Drugs that prolong the QT interval, such as ziprasidone, haloperidol, or amiodarone, can cause life-threatening cardiac rhythm disruptions, potentially leading to immediate cardiac arrest. Medications that inhibit the CYP2D6 enzyme, such as bupropion, cinacalcet, or quinidine, block the body's ability to process risperidone. This causes the drug to accumulate in the bloodstream, leading to severe toxicity, muscle tremors, and an increased risk of seizures. Mixing risperidone with central anticholinergic agents like benztropine, trihexyphenidyl, or hydroxyzine can result in anticholinergic toxicity. This condition leads to severe complications, including urinary retention, bowel obstructions, heat stroke, and acute confusion or delirium. This video serves as a reference for understanding the risks of drug interactions. Being informed about these potential conflicts is a vital component of medical safety and harm reduction. Consult the Vulnerability Summary Matrix for a detailed overview of the physiological interactions discussed. Reviewing this data can help in recognizing the signs of risky drug combinations. Thank you for watching this educational video. Stay informed, stay vigilant, and prioritize safety in all health decisions. For more information, please do your research. Folded hands.